Hey, what's up everyone? This is Julie Reynolds, aka Nurse Jar. In this training video, I'll be demonstrating the 2022 Prometric Testable Skill provides mouth care to a resident who has teeth. This skill is performed on a live person, but for training purposes, I'll be demonstrating this skill on a mannequin. So let's go ahead and get started. Hi, good morning, Mrs. Jones. How are you? Awesome. My name is Julie. I'm your CNA, and today I'm going to be brushing your teeth, okay? All right, Mrs. Jones. Before I get started, I just want to make sure your bed is in a low, safe position, and it is. Your bed wills are locked. I'm going to hand you your call light in your hand. Just press that button if you need anything. Mrs. Jones, I'm going to go ahead and raise your head of bed, okay? So your head can be at a higher position when I'm brushing your teeth, okay? All right, Mrs. Jones, I'm raising your head of bed now to a high Fowler's position. You doing okay? Awesome. Gonna get your head just a little higher, okay? There we go. Awesome. You're doing okay? Great. Okay, Mrs. Jones. I'm going to go provide you with privacy by closing your privacy screen, okay? Mrs. Jones, before I go wash my hands and gather my supplies, is there anything else I can do for you? All right, Mrs. Jones, I'll be right back. Washing hands. Now, because most Prometric test sites will have the needed supplies at the person's bedside, I'm just bringing this overbed table to where the supplies are. The first supply item that I'm going to gather is going to be a chucks. I'm going to use this chucks to place on my overbed table as a clean barrier. I will need one towel, one pair of gloves, one emesis basin, a toothbrush, toothpaste, and a cup, okay? All right, Mrs. Jones, I have all of my supplies together. What I'm gonna do right now is go pour some water into the cup, okay? If you need me for anything before I get back, you have your call light right there. Just press the button, okay? All right, Mrs. Jones, I'll be right back, okay? So now I'm just going to pour water in the cup. Okay, Mrs. Jones, I'm back with some water. I'm going to place this towel across your chest, okay? Just to use as a clothing protector because I don't want to get your gown all dirty, okay? Is that okay? Awesome. The next thing I'm going to do is go ahead and prep my toothbrush. So I'm just taking it out of the package. I'm moistening it in the cup of water. And then I'm going to apply a small dab of toothpaste on the bristles, okay? Then I'm just placing my toothbrush down on my clean barrier, bristles up, and now I'm going to put on my gloves. If you want to put on your gloves before you place the clothing protector and before you prep your toothbrush, that's fine. It's just important that you know that you have to have gloves on before you actually start cleaning the person's mouth, okay? And remember, this skill is performed on a live person. Okay, Mrs. Jones, I'm going to go ahead and start brushing your teeth. There we go. Making sure I brush all surfaces. Awesome. There we go. You doing okay? Great. Let me get the front. Awesome. Okay, Mrs. Jones, could you stick your tongue out for me? I'm going to brush your tongue. Okay, this step is an important step, okay? Of course, Mrs. Jones, she's a mannequin, so she cannot stick her tongue out, but the live person can. So you need to make sure that after you brush all surfaces of the teeth, that you instruct the person to stick out their tongue, and then you will brush their tongue. All right, so now that I'm done, I'm going to place the toothbrush on my clean barrier, bristles up. I'm going to place the emesis basin to the person's chin. So if you look here, I'm sorry guys, the camera's acting up. If you look here, the emesis basin has an indentation. So you'll want to place the basin just like this, not underneath the chin or not out away from the chin, but actually the basin should be, or the chin should fit right here in this groove of the basin, okay? Now for the live person, you can hand them the cup of water, okay, and they can hold the cup themselves. But you, as the testing candidate, you have to hold this basin. So Mrs. Jones is drinking water, okay. Now she can spit the water out into the basin. And what I'm immediately going to do after the person spits the rinse out, I'm going to wipe their mouth. This is one of the most forgotten steps. Okay, Mrs. Jones, do you need more water to rinse? Okay, all right. Mrs. Jones, I'm just going to remove this clothing protector. I'm going to just immediately dispose of it into the linen hamper. Okay. I'm going to pour the remaining water into the emesis basin, throw away the cup. Now I'm going to go to the sink. I'm going to empty, rinse, and dry the basin and rinse the toothbrush. Okay, so now I'm rinsing the toothbrush. I'm emptying, rinsing, and I'm going to dry the basin. So now that I've rinsed the toothbrush and I've emptied, rinsed, and dried the basin, I'm going to place the toothbrush inside of the emesis basin with bristles up. Okay, just like this. I'm going to try to show it to you, okay? So the bristles should be pointing upwards, okay? I'm going to place the toothbrush, the emesis basin, and the toothpaste back into the storage drawer, okay? And keep in mind, the only thing that needs to go into this emesis basin is the toothbrush. Do not place the toothpaste in the emesis basin. All right, Mrs. Jones, I'm just returning the supplies here. Now, the next thing I'm going to do is dispose of my clean barrier. Okay, so if you use a towel as your clean barrier, you'll dispose of it into the soiled linen hamper. Because I use the chucks as a clean barrier, I'm disposing of it into the waste bin. Okay, the next thing I will do, now that I have everything put away and disposed of, I'm going to remove my gloves without contaminating myself. Dispose of them immediately, verbalize washing hands. Okay, Mrs. Jones, does your mouth feel good now? Awesome. All right, Mrs. Jones, would you like to stay in a seated position or would you like for me to lay you back down? Okay, I will lay you back down. It's important that you ask the person about their preferences, okay? Prometric emphasizes patient preference. Excuse me. All right, Mrs. Jones, while I'm lowering your head of bed, I'm just going to make sure your bed is still in the low safe position. Bed wheels are still locked. You still have your call light there. Just press that button if you need me for anything. Would you like for me to keep your privacy curtain closed, or would you like for me to open it back up? All right, Mrs. Jones, I will open your privacy curtain back up. There we go. Mrs. Jones, before I leave, is there anything else I can do for you? All right, Mrs. Jones, you have a very good day, okay? Now I will verbalize washing hands. I will wait a few seconds just to go back through all the steps that I did to make sure I did not perform any steps incorrectly, nor did I omit any steps. Once I feel confident about my performance, I will then verbalize again, washing hands, skill complete.